Are you or someone you know dealing with PTSD symptoms that seem to linger even after trying various different treatments and modalities? Today, I am here to explain a new procedure called the Stellate Ganglion Block, also known as the SGB, which could potentially help ease some of those symptoms by calming the body's stress response. I'm Dr. Ko from Reset Ketamine in Palm Springs, California, and in this video, we're going to dive into the science behind stellate ganglion blocks, what they do, how they work, and what you can expect if you are considering this treatment option. PTSD can keep the body's fight or flight response switched on, causing a state of hyperarousal and/or hypervigilance. This means that people with PTSD, they might feel constantly on edge, anxious, or like they're always prepared for some sort of danger, even when in that moment they're safe. This response is controlled by the sympathetic nervous system. And when it gets stuck in overdrive, it can feel very challenging to calm down and be relaxed. So what is the stellate ganglion block? The SGB is a procedure where a small amount of local anesthetic is injected near the stellate ganglion. And the stellate ganglion is a nerve bundle near the neck that connects your body to the central nervous system. The anesthetic temporarily blocks this area and the nerve signals, which can help reset the overactive response, which can give a body and your brain a break from this constant sense of alertness. The stellate ganglion sends signals to areas of the brain, the amygdala, hippocampus, that's involved in the stress and fear responses. And by interrupting these signals, the stellate ganglion block may reduce levels of norepinephrine, which is a neurotransmitter linked to stress and anxiety. Think of it almost as like turning down the volume of a loudspeaker that keeps broadcasting stress signals. Some studies show that the block can bring a calming effect and even reduce the PTSD symptoms for weeks to months. The procedure itself is fairly quick, roughly 15 to 30 minutes, and done always under ultrasound guidance and visualization. We find and pinpoint exactly the location that we need to go, and some people will even report immediate benefits following the stellate ganglion block, or even a day later or up to a week later. You'll also have something called Horner's syndrome, which consists of a droopy eyelid, a red eye, maybe some nasal congestion, and an increased sensation of temperature, possibly on the right side of the face. In addition, it could cause a hoarse voice and a feeling of kind of like a lump stuck in the throat. Again, this is temporary, lasting roughly 4 to 6 hours. Once the anesthetic fades off, then all those symptoms will go away and everything will get back to normal, except for that fight or flight response. Now, the stellate ganglion block is not for everyone, but it can be beneficial for some patients with persistent PTSD symptoms, especially when other treatments haven't provided enough relief. So for example, certain patients with a history of a recent heart attack, or if they're taking blood thinners, or if they bruise or bleed easily, or even if they just have a severe fear of needles, that would be a reason not to get a stellate ganglion block. So having an evaluation and consultation with a stellate ganglion block specialist is crucial prior to beginning any treatments. Now, what's interesting is that the stellate ganglion block can work synergistically with other PTSD treatments, whether that's medications, therapy, ketamine infusions. And so for some patients, SGB can help with the body's stress response, which can help the ketamine work on the brain portion and making them more receptive. I almost think about ketamine therapy as kind of like working on the software, whereas the stellate ganglion block is working on the hardware. And having both together, they can offer a more balanced and holistic approach where the SGB works on the physical fight or flight symptoms and ketamine can help with the emotional processing and relief in conjunction with the SGB. So the combination, bottom line, is that they can work comprehensively and synergistically together in managing PTSD symptoms. I hope this video helped you gain a better understanding of the stellate ganglion block, SGB, what it is, and how they could help in the treatment of PTSD symptoms. I really appreciate you watching, so please like and subscribe so that you can stay tuned on the latest in this cutting edge field, and I'll see you in the next video.